1. Open the sterile packaging to access the Rondello Primary IV set. Product is sterile. Do not use if package damaged or open. 2. When applicable, close vented cap on the spike. 3. Verify Rondello handle is in a flushing position. 4. Close the roller clamp of the Rondello Primary IV set. 5. Remove the protective covering from spike tip. Exposed spike tip should not come into contact with anything, otherwise it can be contaminated. 6. Spike the infusion bag. 7. Prime the drip chamber with squeeze and release technique. 8. Open the roller clamp to prime the Rondello and the rest of the IV set. If all air is not removed from the tubing, air may be forced into the patient's vascular system and cause air embolism. 9. Close the roller clamp. 10. Remove the prime stop cap of the primary IV set and connect to the patient's IV access port. Check for fluid leakage before and during the procedure. Leaks can result in the loss of sterility, fluid, and/or air embolism. If a product leaks before or during use, retighten the leaking connection or replace the product. All connections should be finger-tightened. Over-tightening can cause cracks and leaks to occur that could result in air embolism and/or exposure to biohazards. Connecting secondary IV set to a drug position to be used of Rondello. 1. Verify the clamp on the secondary IV set is closed before connecting. 2. Verify the Rondello handle is not aligned with the drug position. 3. If applicable, remove the protective cap from the Luer lock connector at the drug position. 4. Remove the cap from the secondary IV set and connect it to the Luer lock connector at drug position. 5. Repeat the procedure for each following secondary IV set. Administer secondary infusions with automatic flushing takeover. 1. Utilize head height differential practice to regulate flow from primary or secondary infusion. 2. Turn the Rondello handle to the drug position and open the clamp fully on the secondary IV set. 3. Regulate the flow rate of the infusion to patient by adjusting the roller clamp of the Rondello Primary IV set. Flushing fluid from the primary bag will automatically take over after the secondary IV infusion is completed. Flushing between and after drug administrations. 1. Turn the Rondello handle to an adjacent flushing position. Disconnect from Rondello. 1. Verify that the Rondello handle is not aligned with the drug position to be disconnected. 2. Verify the clamp on the secondary IV set is closed before disconnection. 3. Disconnect the secondary IV set from Rondello Primary IV set. 4. If applicable, cap the Luer lock connector at the drug position of Rondello. Disconnect the Rondello Primary IV set from patient. 1. Close the roller clamp on the primary IV set. 2. Disconnect the IV set from the patient's IV access port. After patient contact, treat the device as biohazardous waste. Dispose of in accordance with hospital policy and local regulations.